Good evening, dear brothers and sisters. I am very, very happy to connect with you before the auspicious Vinayak Chaturthi day tomorrow. So happy Vinayak Chaturthi. And Vinayak Chaturthi is one of the example of how lifestyle modification can be implemented. Suppose if you don't do any lifestyle modification, just go to the Vinayak temple and then do the Topu Karna. I don't know what you call it in Hindi. That way you can do good exercise. And he has got a big ears, which means you have to learn, listen, and his mouth is shut. That means you don't eat much. And he is getting abdominal obesity, so don't sit on one place. You have to walk around, otherwise you will get the obesity. So that is the lifestyle modification, depict of Lord Vinayaka. Okay. Now, of course, World Lung Foundation, I know most of you know, it's a public health ranging from cardiovascular disease, prevention of road safety, environmental health, civil registration, vital statistics. And all public related activities and the scope of the work cover comprehensive public health service by World Lung Foundation South Asia branch, who is the major sponsor for this program. Of course, World Medical Academy of India, we have been doing a lot of webinars, and our main aim is to educate the public on the prevention of the disease, also sensitize doctors on various public health programs. Then what is the objective of this webinar? All of you know, to promote standardized care and to promote opportunity screening. See, one of the important things which you have to do is, whenever anybody comes to you for any problem, check their blood pressure. Also, not only the patient's blood pressure, even the attendant's blood pressure. That is an opportunity for screening. And you should have a physician, you must reduce the physician's inertia, start and continue treatment of hypertension. To emphasize the importance of medication titration and follow-up to ensure blood pressure control, and also adherence, promote adherence to promote home blood pressure monitoring. These are the 5 webinars which we are planning to conduct, and we already done one last week. And now today we have the lifestyle modification and salt reduction in hypertension, which is one of the important public health activity which is undertaken by Resolve to Save Lives, World Lung Foundation, and WHO. So today we have a very good speaker, Dr. Swati Bharatwaj, technical advisor, nutrition of Resolve to Save Lives and WHO. And we got very good expert, Dr. Nakul Sinha, who is the practicing cardiologist. So we are going to have a scientific feast, and to add salt to your food, I'll be giving some Kahoot also later on. And if you are new, please download the app, Kahoot app, and ready for the end pin, and you can start play. We have got about 14 questions, 20 seconds we give, and as usual, those who get top 3 will get BP monitor. So be ready for Kahoot. And this is Swati, technical advisor, and Dr. Nakul Sinha, cardiologist panelist. And Swati is from Delhi. Is a PhD food and nutrition, public health nutritionist with over 17 years of experience. Worked with organizations like Atlanta, USA, Diabetic Foundation, Fortis Hospitals. Research publications in international peer-reviewed journals. Professional area of interest is research, training, nutrition, trans fatty acid, and high-fat salt food lifestyle modification. And of course, Dr. Nakul is a former professor, HOD of cardiology, SGP GMS Lucknow, past convener of National Intervention Council, PSI, fellow of American College of Cardiology, fellow of Society of Cardiac Angiography and Intervention, fellow of Indian College of Cardiology, fellow of Cardiology Society of India, fellow of Asia Pacific Society of Interventional Cardiology, Commonwealth Fellow in Interventional Cardiology, UK 93-94. He has published more than 150 research publications, reviews, editorials, and book chapters. He was a principal investigator in 52 international multi-center trials. We are fortunate to have Nakul as the panelist today. And of course, next webinar is going to be simplified protocols for hypertension, where I will be the speaker. Dr. Bidita will be the moderator. Dr. Sangram Bazar will be the panelist. So next week, same time, you have to join this masterclass webinar series of hypertension. And now let's start, and we'll request Dr. Swati to present his presentation. Over to you, Swati. I'll stop sharing now. You can. I'm also happy to welcome Dr. Panu Pratap Singh, one of the consultants of the Resolve to Save Lives.
Thank you so much, Dr. Muruknath.
Yes. Go ahead now, Swati.
A very good evening to all. Thank you, sir, for such a warm welcome. And I hope these slides are visible and I'm audible enough.
Yes, you are.
Okay. Thank you. So in order to save some bandwidth, I'll be switching off the video for now, but I'll be coming back again so that the voice goes uninterrupted and the message is conveyed effectively. So as we start our journey for the next 1.5 hours on lifestyle modification and salt reduction in hypertension, I would just like to reiterate that this topic, like Sir already mentioned, is very important in the overall management of hypertension as well as other cardiovascular diseases. High blood pressure or hypertension kills more people than any other condition. According to the Global Burden of Disease study from 2017, it kills more people than any other infectious diseases or any other cardiovascular problems. Reducing blood pressure prevents stroke, heart attack, kidney damage, and other health problems. Now, hypertension is a growing prevalence concern in our country. As per the ICMR-led National NCT Monitoring Survey, which was held in 2017-18, the prevalence of hypertension among people between 18 to 69 years ranged between, it was approximately 28.5%, which led to approximately estimated hypertension burden of more than 20 crore adults, which is huge. Now, if we look at the data from Global Burden of Disease, for the top 10 causes of total number of deaths in 2019 in India, and the percent change from 2009 to 2019, we see that high blood pressure is in the top 3 risk factors over here if we see, and has shown around 24% increase from 2009 when it was at number 4 to the present scenario. Now, in order to track the progress in preventing and controlling major non-communicable diseases like cardiovascular disease, cancer, chronic lung disease, and diabetes, there are key risk factors which WHO developed a global monitoring framework. The framework is comprised of 25 indicators, and this also features raised blood pressure and salt intake as major risk factors. If you see here, there's raised blood pressure, salt intake, apart from other risk factors like low fruit and vegetable consumption, physical inactivity, saturated fat intake. But these two also feature at a very prominent positions in the risk factors that have been highlighted. Now, based on these risk factors, WHO has identified 9 voluntary global targets aimed at combating global mortality from the 4 main non-communicable diseases. To accelerate action against the leading risk factors for NCD to result in a 25% reduction in the premature mortality from non-communicable diseases by 2025. These include targets for reducing raised blood pressure by 25% and for reducing salt or sodium intake by 30%. Now, this itself shows how important these two factors are in order to reduce the premature mortality from non-communicable diseases. Thus, the key factors contributing to the development of cardiovascular diseases and related complications include hypertension, include unhealthy lifestyle, which includes high salt intake, physical inactivity, tobacco use, and harmful use of alcohol. And hence, the key lifestyle modifications for hypertension include maintenance of healthy body weight, dietary modifications, salt reduction, increasing physical activity, reduction in alcohol consumption, and cessation of tobacco or smoking. Now, as we go forward, we will be going through each of these in details. Starting with maintenance of healthy body weight. So studies have shown that obesity can result in serious health issues, including hypertension, type 2 diabetes, increased risk of coronary heart disease, and unexplained heart failure. Studies have also shown that obesity accounts for approximately 65% of cases of primary hypertension. As per the National NCD Monitoring Survey, the overall prevalence of overweight obesity in India is around 26%, which is quite huge. So as part of the patient counseling, the first step is to ascertain patient's BMI to calculate, to understand whether he falls under overweight or obese category, and to establish the calorie consumption that is ideal or required for him. And then we can proceed with the other dietary modifications. So over here, if you can see, WHO has specified classifications for BMI or specifically for Asian Indians. According to this, the ideal BMI is 18.5 to 23 kilograms per meter square, and any above 23, it is overweight, and above 27.5, it becomes obese. And similarly, there are specific energy requirements based on these classifications, according to which the energy is calculated. And this forms the basis for all dietary modifications or suggestions that we provide to the patients. Next, we have the dietary modifications, which forms a very, very crucial component of the lifestyle modification. Under this, what we follow is a DASH diet. DASH stands for dietary approaches to stop hypertension. It is a dietary approach that is planned and designed to help treat or prevent high blood pressure. And it includes foods which are rich in potassium, calcium, magnesium, and fiber. The diet limits specifically foods that are high in sodium, saturated fat, and added sugars. The major goals for major dietary goals which have to set up when we are doing the dietary counseling for a patient includes having a low-calorie diet based on BMI and the activity levels, reducing sodium intake to less than 1500 milligrams. We will be going through the sodium reduction and strategies for patient counseling in detail later. Then setting up the potassium intake between 3500 to 5000 milligrams coming from fruits and vegetables. Now, potassium over here, I would like to highlight, has shown to have positive effect in reducing blood pressure. In India, already potassium intake is quite low, and thus it is important to increase the potassium intake for effective management of hypertension. This diet also focuses on having at least 40 grams of fiber, again coming through fruits and vegetables. The diet also suggests less than 30% calories coming from total fat, with saturated fat between 7 to 10% of the total calorie, and eliminating industrial trans fat. Now, industrial trans fat is the worst fats of all, which is actually created artificially during the process of partial hydrogenation. what we call is while preparing vanaspati or margarine or bakery shortenings. World Health Organization has asked governments to eliminate industrial trans fat from food supply. And thus, as a national policy, I would like to share here that India has brought in the regulation to eliminate trans fat from the food supply, thus eliminating one of the risk factors which can lead to not only CVD but other non-communicable diseases as well. Further, as part of this diet, sugar should be less than 10% and no free or added sugar should be consumed. Then preference should be given to unsaturated fats, which includes nuts, seeds, and poly and monounsaturated fats like mustard oil, groundnut, sesame, canola oil, etc. Oils should always be used in rotation. That is, we should not be specifically using any one oil over the years. Rather, we should always be changing oils. It can be changing oil every month or using different oils for different meal preparations. So whatever the approach we choose, but the oils should definitely be rotated. It also includes low-fat milk or dairy products, whole grains like whole wheat, millets, pulses, legumes, fruits, and vegetables, and avoiding processed foods which are high in fat, sugar, and salt. Now, as discussed earlier, we would be discussing salt reduction in a little more detail over here. It is important to reduce salt intake for effective management of hypertension, as excess salt increases blood pressure and the risk of cardiovascular disease. Globally, excess salt consumption, which is more than 5 grams per person per day, is responsible for nearly 1.65 million deaths from heart disease, stroke, and other related causes. The average salt intake in India is 9 grams per person per day, which is nearly twice the amount specified by World Health Organization. And one more thing over here, which is important to understand is that not only those with hypertension, but people with normal blood pressure also benefit from lowering their salt intake. Over here, I would like to take you through the salt intake across different parts of our country, which we were able to understand through different studies. So if you see closely in this table, you can see that the salt consumption in India ranges between 6.5 grams per day to as high as 12 grams per person per day, which is more than double the WHO recommendation. Now, most of us think that, yes, the salt intake is high, and it is high majorly because of packaged and processed foods. Well, that is partly correct. Processed foods do contribute to total salt intake. However, if we see, research studies have shown that the major salt intake comes from salt which is added during cooking at home or at the table. So over here, we see that if we see here, approximately 86% of the total salt is coming from salt which is added during cooking or at the table, and approximately 3% coming from snacks and bakery foods. Thus, our dietary counseling should focus on home-cooked foods, home-cooked meals, along with the packaged also. One example I would like to share. So if there's a salt shaker kept on the table, and if we use it and just add salt, so we don't even realize, but one dash of salt, which we are adding using the salt shaker, approximately provides us 150 milligrams of sodium. Now imagine if it is done 10 times a day. So it accounts for nearly 1500 milligrams of sodium, which is actually the recommendation for a hypertensive person. So that is why we need to be really, really sure and stop ourselves from adding any salt at the table while eating. Coming on to the recommendations, the National Institute of Nutrition has set up recommendations for salt for Indians. Before we proceed to that, I would like to explain here that when we say 1 teaspoon of salt, it means 5 grams of salt, which is 200 milligram of sodium. Now, this is very important because a normal table salt contains 40% sodium and 60% chloride. So when we are saying 1 teaspoon of salt, we mean 200 milligram of sodium or 5 gram of salt. So as per the recommendations set down by the National Institute of Nutrition, there are 8 specific recommendations that if you are more than 10 years of age, then the recommended amount of salt to be consumed is approximately 1 teaspoon of salt, which is around 5 grams salt per day, or nearly less than 200 milligram of sodium.
2000 milligram, 2000
milligram of sodium. So, however, these recommendations are for normal population. But if we talk about hypertensive people, it is recommended to keep the sodium intake to less than 1500 milligram per day, which is roughly around 3/4 spoon. If you see over here, 1600 milligram of sodium is around 3/4 teaspoon. So we can say that roughly if we take 3/4 teaspoon of salt, it meets the recommendation for salt for a hypertensive person. Now, coming on to the strategies for reducing sodium, and these should target all sources of salt across the food chain, including the salt consumed at home, outside home, through behavior change interventions to reduce salt while cooking, while eating, be it at home or outside the home. Suggested use of low sodium salt also as a strategy. Decreasing consumption of packaged foods through behavior change intervention to reduce salty processed foods while shopping or purchasing. And most importantly, clarifying myths around salt or sodium consumption. Now, low sodium salt or potassium enriched salt are salts where a percentage of sodium is replaced with potassium. When we are discussing about sodium reduction, it is important to discuss about low sodium salts as well. Low sodium salts available in Indian market are usually have 10%, 15%, or 30% of sodium replaced with potassium. These are fortified with iodine as per the recommendations or regulations laid down by Food Safety and Standards Authority of India. Indian and global studies have shown that low sodium salt significantly decreases systolic and diastolic blood pressure. And these studies have established the effectiveness of low sodium salt substitution as a very important intervention that can reduce the overall sodium intake at population level, especially when we know that there is high proportion of salt which is added at home. And Indians are invariably consuming a very high salt through all their meals, and be it at home or outside. Again, so these salts have a percent of sodium replaced with potassium. Now, high potassium intake, studies have shown, are associated with lower levels of blood pressure and reduction in cardiovascular disease. WHO itself recommends increasing the potassium intake from food to reduce blood pressure and risk of CVD, stroke, and coronary heart disease in adults, and to control blood pressure in children as well. Now, coming on to the patient counseling strategies. What should we be doing when a patient walks in and we are supposed to counsel him for reducing the total salt intake? So we divide it as we counseling him for reducing the salt while added during cooking. Then the other strategy would be at the table or while eating, and then reducing salt intake when he or she is outside the home. So starting with reducing salt while cooking. So we need to give very simple, clear key messages. When preparing rice, chapati, puri, paratha, do not add salt. One of the key areas where major salt is added in our meals. So whether the person is preparing rice, paratha, puri, whatever, salt should not be added. Then salt should be gradually reduced over time. If we say, okay, from tomorrow, stop eating salt or reduce salt by half. No, it is not a practical way and nobody would be following it. The effective methodology is gradually reduce. For example, make salt purchased for cooking last longer. If suppose 1 kg of salt lasts over for 6 weeks, then make it last for 8 weeks. And then prepare and consume less of foods which are high in salt, like chutney, papad, rasam, etc. The next is at the table or while eating, limit the use of chutney, papad, or pickles as a side accompaniment with the meals. Whenever possible, do not add salt at the table or taste before you add. So some people usually have a habit that when they start eating food, the first thing they do is just add salt. So that is not recommended. What is suggested is that when you, even if you want to add salt, you first taste the food before adding salt, and if at all possible, do not add salt while eating. And avoiding processed foods and prefer freshly prepared foods or fruits and healthy fresh fruits and vegetables as snacks. Whenever you're eating out, patient should be asked to that he or she may ask the person preparing the food to prepare it with less of salt. Avoiding foods which are high in salt, like samosa, pakora, chaat, etc., as they have excess amount of salt, and limit the food accompaniments like salted butter, salty spices mix like chaat masala and other things, chutney, pickles, papad, ketchups, and dressing. Sometimes what they think is that eating a bowl of a salad is healthy, and they asked the manufacturer or the food server to prepare salad. What they do not understand is that when salad dressing is added to it, which is high in salt, then the healthfulness or the wholesomeness of the salad is lost, because with the salad, excess amount of salt is also being consumed. Again, another important area is limit the purchase of processed foods, ready to cook foods, and instant foods such as noodles, soups, pickles, and papads, as they have the highest level of salt. Then limit the purchase of snacks like namkeens, murku, chips, and papad. And if possible, purchase low sodium iodized salt instead of regular salt. Now, it is also very important to demystify some of the myths around salt consumption. People usually think that rock salt, or what we call as sendha namak, or black salt, or Himalayan pink salt, they reduce blood pressure. However, we have seen studies, and studies have shown that no, this is not true. The fact is that these salts have similar level of sodium and do not reduce blood pressure. So thus, rather than choosing these salts to cut down on the total sodium intake or total salt intake, you should always prefer iodized salts and limit their consumption as well. Next, there is a belief that body needs more salt during hot seasons or while performing physical labor. The fact is that no, we do not need more salt. What we need is more water. Then parents usually think that children need more salt. They need it to grow well. That's again a myth, because in fact, children should consume less salt than adults. Excess salt is harmful for children as well. So we've seen in the previous slide that National Institute of Nutrition has laid down standards and recommendations for salt consumption even for children. And if we see here, I'll take you back to that slide. If we see here, children from be it 1 to 3 years, 4 to 6 years, 7 to 9 years require lesser amount of salt. They do not need 1 teaspoon of salt, rather much less. Again, we need to demystify this myth that children need more salt to grow. Then people sometimes say, we've heard it in the OPD, that reducing salt in the diet can actually lead to weakness in the body. So no, it does not lead to weakness in the body. Less than 5 grams of salt per person per day is good not only for your heart, but also for your kidney. Then there's a myth that lowering salt intake may lead to low blood pressure. Well, again, this is not correct. Eating less than 5 grams of salt per person per day, that is less than 1 teaspoon of salt, is actually helpful in keeping the blood pressure normal. Coming on to our next lifestyle modification, which is physical activity. Now, WHO defines physical activity as any movement produced by the skeletal muscles of a human body that use energy. Studies have shown that insufficient physical activity is a key risk factor for CVT, cancer, and diabetes. People who are insufficiently active are 20 to 30% more likely to die prematurely. And regular physical activity reduces blood pressure of individuals with hypertension. And large prospective studies have shown physical activity is actually inversely associated with development of hypertension. Over here, if you see this graph, it clearly shows the improvement in both systolic as well as diastolic blood pressure following an aerobic, resistance, or concurrent activity. So concurrent activity over here means mix of both aerobic and resistance training activity. So in the ICMR-led survey, it was shown that around 41.3% of adults do not meet the WHO recommendation for physical activity. And insufficient physical activity is higher among urban population as compared to the rural population. If we see over here, 60% of urban women are physically inactive as compared to 49% rural women. So what is the recommendation? What do we tell a person when we're talking about physical activity? So WHO says, as per the recommendation, approximately 150 minutes of moderate physical activity per person per week, or approximately 75 minutes of vigorous physical activity per person per week is what is suggested. There can be an equivalent combination of moderate and vigorous physical activity as well. And muscle strengthening activities involving major muscle groups on 2 or more days a week is also suggested. It also recommends that moderately intense physical activity can be increased to 300 minutes per person per week for additional benefits. Here, I would like to add that these recommendations apply to all adults, including those with CVD, with hypertension, unless there is a specific medical recommendation where the person cannot perform any physical activity. Then there are people who have reduced mobility. So for them, it is suggested that they can perform physical activity on 3 or more days per week in order to improve balance and also prevent falls, because physical activity also aids in developing fine balance and preventing falls. However, if the recommended physical activity regime cannot be undertaken because of health constraints, then it should be adapted as abilities and conditions allow. Now, this would require medical intervention and also intervention by a fitness expert to understand how best these can be adapted as per the requirement of the patient. Next, we have smoking. or tobacco consumption. Tobacco use here refers to smoked, sucked, chewed, or sniffed tobacco. The products of tobacco products are generally of two types, which are smoked tobacco, which includes cigarettes, cigars, pipes, and smokeless tobacco, like chewing tobacco and snuff. Tobacco is one of the main risk factors for CVD, causing an estimated 10% of all CVD deaths, which amounts to approximately 6 million deaths globally. In our country, as per the ICMR-led National NCD Monitoring Survey, the current tobacco use was almost 33%, with 48.5% adults exposed to secondhand smoke at home, workplace, or during travel. Lifestyle modification for hypertension includes mandatory behavior change counseling for quitting tobacco use. This is something which is mandatory, telling them doing adequate behavior change counseling to make them quit tobacco. Next, we have harmful use of alcohol. So this is another lifestyle modification which needs to be undertaken. And over here, when we say harmful use of alcohol, it refers to drinking that causes detrimental health and social consequences for the drinker, and also people around the drinker and society as a large, and as well as patterns of drinking associated with increased risk of adverse health outcomes. Now, high level of alcohol consumption and regular heavy episodic drinking are associated with increased risk of hypertension and CVD. Harmful use of alcohol also damages the heart muscle, increases the risk of stroke, and can cause cardiac arrhythmias. The studies have shown that the alcohol consumption is associated with elevated systolic and diastolic blood pressure. In the ICMR-led survey, the mean age of initiation of alcohol use is as young as 22.2 years, with nearly 16% adults using alcohol in the past 12 months. They were actively consuming alcohol, out of which 6% were actually engaged in heavy episodic drinking. Now, over here, behavior interventions again in primary care are useful in identifying and managing people with alcohol problems. Sometimes, due to societal pressures associated with alcohol consumption, the patient may not be willing to share about his or her alcohol consumption. And thus, at that time, adequate probe during the diet history recall when the patient is being dealt in the OPD becomes very, very important. And as a strategy, the patient is advised to gradually reduce the alcohol consumption. Over here, we've seen all the different lifestyle modifications and how what are the recommendations, how we are supposed to take it forward. Here in this table, we would like to showcase then how each lifestyle modification, when adhered to properly, what impact does it have on the approximate blood pressure. So if we see weight loss, so approximately it can, for every 1 kg reduction in the total body weight, it is estimated that there is a reduction in the systolic blood pressure by 5 mmHg. For the healthy diet, which is diet rich in fruits, vegetables, whole grains, like we discussed previously, the reduction can be as high as 11 mmHg. Similarly, for reduced intake of dietary sodium, which is less than 15 milligram per person per day, which is the optimal goal, it ranges between 5 to 6. And then enhanced intake of dietary potassium between 3,500 to 5,000 milligram per person per day is also between 4 to 5 mmHg. The systolic blood pressure reduction by following aerobic activity for 90 to 150 minutes per week is 5 to 8 mmHg. in hypertensives, and bringing moderation in alcohol consumption for individuals who drink alcohol, which is men less than 2 drinks per day, women less than 1 drink per day, is also around 4 mmHg. So over here, we've seen that there is reduction. The reduction is significant. However, these lifestyle modifications are not an alternative to the medical intervention, to the drug therapy. These can be used, these have to be used along with the medicines and the drug therapy, not as a standalone intervention. So this is something which is very, very important for all of us to understand. So what is the take-home message for patient counseling? Which is the critical feature of patient counseling, which includes that diet history, estimation of energy intake, and requirements, setting up requirements as per the BMI should be actually an essential part of the patient evaluation and follow-ups at the OPD. The patient counseling should include lifestyle modification for all the risk factors and recommendations which have been discussed previously. Customized counseling as per their local, regional, dietary and lifestyle practices is a must. For example, if we tell them that you should be doing this and you should not be following this, could be following this, without basically understanding what their actual practices are, these will not be impactful or effective. If, for example, there's a person living in Madhya Pradesh, or I say Indore, which is the snack hub of India, and where there is too much emphasis on consumption of savory snacks, namkeens, as the integral part of the meal. So over there, the healthcare provider, the counselor should understand this and emphasize on, should be laid on customizing the counseling for the patients to gradually cut down on the quantities of these savory snacks taken with the meal. Similarly, in case of Gujarat, if we say where savory snacks are consumed as part of the main meals, so the counseling needs to accordingly emphasize on these points. Next is the behavior change intervention. Now, this is very, very important. There have been studies which have shown that that positive changes in lifestyle modifications can actually be achieved when behavior change interventions are used. When we say behavior change interventions, we refer to a set of activities like regular follow-ups, telling them through follow-ups on how to perform a particular behavior, how to cut down on their salt intake, setting up quantifiable action points, and interventions which are in smaller duration and frequency. So setting up smaller goals which are easily achievable. So in order to in order to have positive reinforcement, it is also very, very important. And setting up small intermediate goals, they are important. And as said earlier, lifestyle modifications which have been discussed here have to be used along with the pharmacological treatment and not as a replacement for medications for hypertensive patients. So all the points discussed above are also explained in the HEARTS technical package developed by World Health Organization and Resolve to Save Lives. This particular package is intended for trainers of primary healthcare workers, including physicians, nurses, and other health workers. Further, it is also very, very important that the healthcare team should be trained on these risk factors and counseling approaches, which adapt to the local customs, cultures, and context for successful interventions. So with this, we come to the end of this presentation. Hope you found it useful, and I'm happy to answer any query or question on this.
Thank you, Swati, for the nice presentation. Before I go to my expert friend Nakul, we will play the Kahoot for 5 minutes, and then you can stop sharing your slides.
Okay. Yes.
Yeah. Now we'll go to the Kahoot. Those of you who have joined new, please download the app Kahoot. And as I told you, every question only 20 seconds. And we'll give a game pin number. And then we can play the game. Please get ready to join. We'll give a game pin. It's 182147. 182147. You can start playing the game by enrolling. You've been Hemant first, Priscilla, Suresh Khanna, Meghanathan, Sati. I'll give you 5 more seconds. Please join. Last 2 seconds. Rahul, Gita, Vijay. Yeah, let's start now. Three, two, one. How we can reduce the salt consumption at home? 1, not adding salt, limiting the consumption of salty, not having a salt shaker, choosing the products with lower sodium content, all of the above. 30 seconds. In fact, we have given 30 seconds for this question. It is not necessary. Yes, excellent. All the 33 have answered correctly. Now, next. Sundarapandi, Meghanathan, Manish, and Rekha. Next question. How much amount of salt WHO recommends that adults consume per day? Salt. Less than 15, less than 5, less than 10, less than 8. It's only 20 seconds for this question. Less than 5. You must understand this is salt, not sodium. Sundarapandi, no, Rekha, Gary, and then Meghanathan. And third question, what are the main behavioral risk factors for CVD? Unhealthy diet, tobacco, insufficient physical activity, harmful use of alcohol. All. Again, we are given 30 seconds. These are the behavioral risk factors. Very good. Almost 100% correct. 37 have answered correctly. Rekha, Gary, Meghanathan. Now the fourth question. Non-pharmacological intervention in hypertension management includes aerobic activity, reduced intake of dietary sodium, moderation alcohol, healthy diet, all. Purposely, we have given very easy questions so that you will understand all the lifestyle modifications, because that is very, very important. We must take some time in every patient to explain the non-life pharmacological interventions in hypertension, obesity, and diabetes. Yes, all 42 are right. Very good. Now again, Rekha, Suresh, and Gary. Fifth question. Among the following, which one is the highest source of salt or sodium in our diet? Dairy and dairy products. Salt added during cooking at the table. Meat, poultry, egg, fish. Snacks and bakery food. Which one is highest source of salt in our diet? Excellent. Swati showed a slide where 86% of the salt is through your salt added during cooking and at the table. Rekha, Selva Ganapati, Suresh Khanna, Manish. Then sixth question. Which of the following statement is false about patient counseling hypertension management? False. Diet history, an essential part of patient evaluation. Low level of potassium intake associated with lower levels of BP and reduction in CVD. Lifestyle modification is used along with pharmacological treatment and not as a replacement. Customized counseling for every hypertensive patient. Yes, low level of potassium intake associated with low level of BP is the false statement. Rekha, Selva Ganapati, Suresh. Then seventh question. Which of the following statement is not a myth around the salt consumption? Not a myth. Rock salt reduces blood pressure. Excess salt increases blood pressure and risk of cardiovascular disease. The body needs more salt during hot seasons and heavy physical labor. More salt is needed for children to grow well. So, which is not a myth? Three are myths, one is not a myth. Which is not a myth? Very good. Excess salt increases blood pressure and risk of cardiovascular disease. Not a myth. Again, Selva Ganapati, Manish, and Emmanuel. Now, eighth question. Dash diet stands for diet and the association sustain hypertension, diet and salt modification for hypertension, dietary approach to stop hypertension, dietary associations to stop hypertension. We always say dash diet, dash diet. You should know the abbreviation. What is dash diet? Yes, it is the dietary approaches to stop hypertension called dash diet. Again, Selva Ganapati, Manish, Emmanuel. Now the ninth question. Diet strategy for hypertension should also focus on reducing potassium intake, increasing sodium intake, increasing potassium intake, both option A and C. Diet strategy should include focus on reduce potassium and increase sodium. Yes, increasing potassium intake. That's why we always say fruits and vegetables. Always dietary potassium is important, not the potassium directly through the diet source. Healthy diet, how affect in hypertension? It increase 5 millimeters, decrease 5 millimeters, decrease 11 millimeters, and decrease 2 millimeters. Healthy diet. Dash diet. Yes, it decreases 11 millimeter. It is one of the really good lifestyle modification. Those of you who are not taking vegetables and fruits 5 servings a day or 4 servings a day, please start doing it because the vegetables contains potassium and fiber, which is good for controlling the hypertension. So now the best lifestyle modification you should adapt. Again, Selva Ganapati, Rekha, Emmanuel. Now 11th question, reduce sodium intake. How effect reduces the hypertension? Decreases 5, increases 5, decreases 10 to 12, decreases 15. Sodium intake. Yes, decreases 5 to 6. Selva Ganapati, Rekha, Emmanuel. 12th, which lifestyle modification leads to maximum blood pressure reduction? Weight loss, healthy diet, reduce intake of dietary sodium, or moderation in alcohol? Which lifestyle modification? is again healthy diet is the best lifestyle modification. Of course, when you do a planned resistant exercise, that also can reduce more than 11. Okay, Rekha, Silva Ganapati, Emmanuel. And 13th question, as per the National NCD Monitoring Survey, the prevalence of hypertension among 18 to 69 years is 26.5, 40, 16.5, and 28.5. You may remember the first few slides, Swati has mentioned the survey, the prevalence of hypertension among 18 to 69 years, NCD monitoring. Yes, it is 28.5, nearly 30%. You know, that's why hypertension, you will have to focus, you have to do screening, awareness, etc. Rekha, Emmanuel, M.I. Hasan. Last question. How much of sodium is recommended for hypertension person per day? Sodium. It is not salt, sodium. Less than 1,500, 2,300, 5,000, less than 2,300. For hypertensive person. Yes, it is less than 1,500. 1 teaspoon of salt is 5 grams of 5 grams of sodium, and a 3/4 of a spoon will contain 1,600 milligram per day. So we'll see who are the winners now. Silva Ganpat, 12 out of 14, and Hasan, 13 out of 14, and 14 out of 14 is Emmanuel. So congratulations, winners. I request the Rekha is fourth and consolation, but Emmanuel and Hasan and Silva Ganpat will receive the BP monitors. I request Megha, please note down their courier address. Please send your courier address with PIN code and the mobile number. Okay, now I'll stop sharing. Now we'll go to the panelist. Dr. Nakul, are you there? Dr. Nakul? Megha, please, call Nakul. Before that, okay, I'll go to Swati. Swati?
Yes.
Swati, yeah, it was a nice presentation. And one more suggestion, whenever you talk about lifestyle modification, which, international guidelines, everybody says, but we have to add sleep hygiene, sleep. Sleep is one of the important lifestyle modification because a lot of people don't take good sleep, especially doctors like Vidita. You know, she is working all the 24 hours, go day in and day out, and they don't care about sleep. So sleep, stress-free life, meditation, and yoga, also part of lifestyle modification. So one should learn to do a nice good sleep. They should go to bed early by 10 p.m. For 10 to 11 p.m., the growth hormone and the IL-12 secretes, which are very good for immunity also. So always, you have to add sleep. Welcome, Nakul. Nakul, I was telling Swati, the lifestyle modification, you should also add sleep. Good sleep is also very good for, blood pressure. Nakul, your comments on the whole lifestyle modification, your expert comment on what one should do, the lifestyle modification about the hypertension management.
A very good evening, everybody, and a special thanks to Dr. Muruganathan and his team. I hope I am audible.
Yeah, you're very much
okay.
Nice.
First of all, I must say that this is not only a symbolic thing, but this is a very necessary thing going back to the basics. Why? Because, we tend too much to focus on medications. And if we go back to our textbooks, which we read so many years ago, but the truth is still holds that any treatment has to start with prevention. And in prevention, you have various measures which invariably are lifestyle measures. So I think it's a very important lesson that we should go back to the basics and focus on that. And not only for our benefit, but for our patients' benefit. And I think this is the month, the next month is the World Heart Day. And we are also holding a series of programs, as always, for the general public, for the professionals, for the school children, all trying to make them aware the importance of diet, exercise, etc., and which can have a very far-reaching impact on the burden of these non-communicable diseases. Now, as regards the seminar, I would like to compliment Dr. Swati because she has taken us so systematically, and that too backed by evidence. We can't say that there is sort of anything which is unsubstantiated. So it's all evidence-based medicine which is being discussed here, but made so simple, so interesting, so relevant, and so important. So I think this whole idea is really excellent, and I must again sort of not only compliment you, but thank you for roping me in.
Yeah.
In fact, you were saying that sort of we miss out the sunlight. So I think it's symbolic that the twin towers that have been brought down are allowing the sunlight in the sort of so many residences which were being dwarfed by them. So that way also we should try and bring down the twin towers of our sort of very, very busy lifestyle, stress. I think stress is extremely important. Whatever you say, it influences our diet and pattern, our thinking, our exercise, lack of exercise rather, our sort of liking, I won't say liking, but perhaps our preference sometimes for these fast and junk foods, which have so much of sodium and less of fresh fruits and vegetables. So I think all these are extremely important. And in fact, I also suggest to my patients and during the prevention talks that they should have posters. The school children can make such posters, and every house should have a poster inside to at least keep them reminding as to what you are missing, what you are not doing, what can easily be done without any cost, without spending on medications, investigations, and costly treatments. And still that can get you a lot of benefit. So I think, yes, excellent. And I mean, we can go on with the discussion if there are any further points.
Nakul, now watching television for more than 2.5 hours per day is also a risk factor. And also many people.
Sorry, I didn't get your question.
No, not question. I'm just saying, watching television for more than 2.5 hours a day is again a risk factor.
Absolutely.
In the modern time, most of us, including the adults, women, and men, watch TV, serials, and
in fact, sir, if you, I mean, I was at a school recently where I had taken my friend who is a senior pediatrician, because the school people had invited me, and he was telling the children the very simple formula of 5, 2, 1, and 0. He made them memorize it. So I was also very interested. So then he came out, what do you mean by 5, 2, 1, 0? So that was for children, but I think it's absolutely applicable for adults also. 5 was 5 servings of fresh fruits and vegetables in a day, which hardly any of us had. I think the ma'am showed that hardly 9% or less even of us are taking a substantial amount of fruits and vegetables a day. The 2 meant what you said, the less than 2 hours of a screen time. Now, besides television, we have this monster with us, which we are carrying every day in our pocket. That's our mobile phone. It's should be put to use rather than it should be dictating us. So 2 means less than 2 hours of a screen time. And 1 actually meant that we should sit with the family relax, talk about, be away from other things, and also do physical exercises. For children, it should be at least 1 hour. For adults, well, maybe we can make an exception and say 30 minutes or 45 minutes, but at least we should aim at 1 hour. And 0 was for carbs, carbohydrates. So as less carbohydrates as possible. So that sums up a very nice formula, 5210.
Yeah,
And
actually,
I think it's totally applicable to us adults also.
yeah, adults we use 0 for no smoking, no tobacco. That is
Yeah,
0.
yeah,
And that's what we do.
absolutely.
5210. Excellent, Nakul. And I was telling you, many people watch television and they eat food in front of the television, and they don't have any control when they watch the serial or when they watch the cricket match. They consume more food. They don't. That's why I always tell my patients, don't watch TV more than 2 hours. Don't eat in front of the television, because we always give the analogy. In those days, the television was very bulky. The patient who is watching will be thin. Now the television is thin. The people who are watching are bulky. We have the abdominal obesity. So we always say. And regarding your school, we normally conduct from our area some training for the teachers, school teachers. What is lifestyle modification? What they have to, talk to their students. In fact, 3 days back, I was in a school. I was telling them about healthy diet and healthy behavior, because we must start the healthy behavior from the childhood, so that I always say fast food takes faster to the grave, so you should avoid fast food. Nakul, I coming back to you for the exercise. Uh, what sort of resistant exercise you advise for hypertensive patients? Somebody is hypertension. Will everybody can do resistant hypertension and resistant exercise, and how do you advise?
I personally sort of discourage them to go too much for this gym sort of business, because there it's very difficult to differentiate into the good isotonic and isometric exercises. So I usually say that take a walk in the park, take fresh air, go to places which have more greenery, where you can loosen up your limbs. If you want, you can do some light stretching exercises. And I always tell the elderly patients that that will help your limbs, joints, and all the systems. So a brisk walk, I would say, should be on top of our agenda. But yes, everybody can have some variety, no doubt. But these muscle build, because sir, these sort of youngsters, they indulge into too much of these protein shakes and high protein diet, which we know is that Atkins diet, the high protein, no carb diet. So I tell them have a balanced thing. We are not saying take 0 carb, but take the healthy carbs, take the not the refined sugars, take the complex carb food stuffs. So I think that should be our motto, to be more near the nature, to be more sort of near the healthy environment also, which should benefit us.
Yeah. From you, I'll go to Swati. Are you there, Swati?
Yes, sir, I'm ready.
Yeah. Tell me, what is meant by one serving?
1 serving of fruits and vegetables.
Yeah. When we always say 1 serving of food, 1 serving of this, what is that 1 serving means?
So 1 serving, we usually take 80 to 100 grams of fruit, which is a medium-sized apple, 1 banana, a medium-sized pear. And if we're talking about large fruits like watermelon or sapota or other things, then one small to medium bowl of cut fruit is 1 serve.
Okay. And coming back to because you are a nutritionist, anything you would like to advise, because you said trans fat elimination, what oil they should take in a hypertensive patient? Any particular oil, or how do you advise about the oil?
So yes, sir. So as part of the DASH diet also, we suggest preferring unsaturated fats, which is poly and monounsaturated fats, which basically come to us in form of mustard oil, if you're talking about oils, it
Okay.
is mustard oil, rice bran, sesame oil, canola oil, groundnut oil. And these should not be like, we should not fix them for our regular use. We should keep rotating them, changing them, because one particular oil will have a set of omega-3, omega-6 ratio. The other would have a different set. So we, by interchangeably rotating them, we are bringing in the goodness of all the oils. And when I say rotation, we should go back to our traditional practices when specific vegetables used to be cooked in specific oils. Like, for example, bitter gourd used to be cooked in mustard oil. That was the way, that was a particular way of actually rotating the oils. Now here also we suggest that you can rotate oil, either use different oil, 2 different oils for different meals, like breakfast cooked in one particular oil, or lunch or dinner cooked in one particular oil. Or if that is not possible, then for 1 month we purchase 1 packet of oil, 1 liter of oil, we use it for 1 month, and the next month we change the oil. We do not use the same oil. So that way we can very, very nicely rotate the oil. With reference to the total fats which we are talking about, then inclusion of nuts and seeds, nuts like almonds, walnut, and seeds is also very, very, it's also a healthy way to include good fats in your diet, like omega-3, omega-6, by including flax seeds and nuts, walnuts, and almonds.
Okay. And normally people will ask about the nuts, whether it should be taken as a dry nuts. For some people soak in water the whole night and then take it. They peel the skin off. What is your suggestion? How do you take it? Almond, for example, almonds.
Yes. If you either take it as dry or as wet, but do not peel the skin. The skin should not be peeled. It should be consumed as is, because skin also has fiber in it, has a lot of good nutrients in it. So it should not be peeled and taken off.
Okay. Karthik is asking a question. I'm going to the chat box now. What should be the salt intake per day in renal patients and CKD?
So salt intake, when we are talking about, if we say hypertension and kidney disease or kidney disease alone. So salt intake for a normal person is less than 5 grams, which is around 2000 milligram of salt. That in itself brings down the salt to less than 1500 milligram, sodium to less than 1500 milligram per day. So that is the salt we start with. However, it depends upon how the severity of the condition, on which stage is it. So unless very much prescribed, it should be retained at 1500 milligram per person per day.
Okay. Balaji is asking a question. In a recent New England Journal of Medicine article, a trial conducted in China adding potassium in regular salt doesn't show any positive effect on hypertension and serious morbidity. What is your comment?
Yeah, so the trial which he is referring to is the SAS trial, which was done in China. So though there was this thing that there was no significant difference, but yes, there was a change. And I was just typing the answer for this question, so I'll type and share it as well.
Yeah.
Because there are several other studies, including the SAS trial. We have India-specific studies also, which showcase that increasing potassium in the diet can actually have beneficial effect on the hypertension, reducing the blood pressure.
Yeah.
And I'm sharing the reference as well.
Yeah. The point here we must emphasize, by taking potassium as salt may not reduce the blood pressure, but taking potassium in the diet definitely is helpful. So that is why you cannot give only potassium salt as a salt and then say reduction of the BP. No, it is only the dietary potassium, which is very good. And of course, we now have the low sodium salt added with potassium by 10%, 20%, 30%. That's okay. But we don't claim because of that potassium, the blood pressure is reduced. Because only the dietary potassium is, very good. What do you say, Swati? Any opinion about this?
So potassium overall has a positive effect on reducing the blood pressure. However, if we talk about actual consumption in practice, potassium basically comes from fresh fruits and vegetables. And if we say the diet, specifically in India, it is low in fruits and vegetables. There are several reasons associated with it. So while it is yes, dietary potassium coming from fresh fruits and vegetables is suggested and recommended, but additional potassium coming from part substitution from sodium through low sodium salt is also a relevant intervention.
Yeah, it is a relevant intervention in an indirect way, I think, because when you reduce sodium, the effect is more. So by adding potassium, of course, it adds the value, but only taking potassium alone is not
No.
the solution. Yes.
Yes, it has
Yeah.
to be part of a proper healthy diet.
Yeah.
Just increasing potassium, yes, will not do any good. So as part of the healthy balanced diet, which is recommended for hypertensives, yes, potassium intake can definitely lower down the blood pressure.
And Dr. Garima from Indore, you were talking about Indore and Namkeen and all that. He is asking a question about ketogenic diet and hypertension.
So there are not very strong evidences supporting ketogenic diet. And what we suggest is rather than going in for a high ketogenic diet, which is also kind of a fat diet, comes under the qualification of fat diet, a balanced diet adhering to all the prescribed limits and recommendations is what is recommended.
Okay, Nakul, regarding the lifestyle modification, is there any other advice you give apart from the routine advice about the various things? Any specific?
Sir, can I ask Dr. Swati what would be the recommendations for calcium and magnesium also?
Yeah.
Because I mean, we tend to use so many calcium and vitamin D supplements these days.
Yes.
I'm personally not very sort of attracted by the evidence which is there, but this has become a sort of a routine prescription by most of our physician friends. So
That's right.
I would also request your comments on that, sir, and Dr. Swati's.
Yeah. Swati, you take the question first, then I'll answer.
So when we say calcium and calcium supplements, so supplements are usually given on the basis of some result of some blood work. So otherwise, if a diet is wholesome enough, including dairy products, pulses, millets, green leafy vegetables, then our diet is sufficiently good enough in calcium as well. However, if there is a need for calcium supplement shown during probably the blood work or the DEXA, or then definitely yes, there is a need.
What about magnesium?
Same for magnesium. Our diet is, if we are including relevant amount of fruits and vegetables and all other things, whole grain cereals, then yes, it is sufficient. But what we see around is that the consumption has reduced. It is more of a packaged food consumption, which we are seeing. So in that case, the ultra processed foods do not have these nutrients. Then definitely there is a need. So that all depends on adequate diet history, which is to be taken for the patient or any other person, and based on that only we can proceed with supplements. So you muted.
See the slide. One more point I want to bring it to your notice, Swati. The sodium also produces hypertension in the one of the different ways, because you see immune system, increased sodium, increased osmolarity can also do a modulation of T cell activity, T helper cells and M1 macrophage, and regulatory T cells, M2 macrophage, and systemic inflammation and autoimmunity. And that leads to endothelial dysfunction, increased sympathetic nervous system activity, impairment in pressure, natriuresis, and hypertension. The usual way is, hemodynamic effects like stimulation of osmosensitive neurons, corrected in the cardiotonic steroids, increased sympathetic nervous system, cardiac output, peripheral vascularization. This is the usual hemodynamic effect. But there is one more point also, immune system. Through the immune system also, sodium is supposed to increase the blood pressure. Just a point, Swati, for your completion. So whenever you talk about salt, think about the immune-mediated hypertension through the salt. Okay. Now,
Yeah.
Nakul sir, in the in the hypertension, people say they should not do isotonic, isometric weightlifting and things like that. What is your take on that? You already told me best exercise is aerobic, but some people are crazy about going to the gym and they bent upon doing tumble and things like that, which should be
Well, you are absolutely right. Gymming is a more of a craze rather than people understanding it and utilizing it. Because I mean, fine if you have to be a bodybuilder or a professional wrestler or in a sports which demand your body to be sort of overinflated, if I can use that term, that's another matter.
Yeah.
But I think I always tell them that, see, if you look at the life expectancies of the general population and the very high intensity athletes or who are playing professional football or etc., then there is a difference, and those athletes are not expected to live longer than the general population. It's a myth. And you should understand that the principle is that everything in moderation, everything in a balance. I tell them the nature has provided us with a balance. We see that everything changes, everything comes in a cycle, everything has, if there is a sort of heat today, then there is going to be a winter after some time. So everything comes in cycle and has to be in a balance. So we should also not try to disturb the balance and go along with that and do a little bit of everything according to our needs and preferences. And if you need to sort of take up some heavy exercises, always have a professional advice before doing that, because we have had cases where undetected hypertension people landed up in serious problems after doing sort of very severe and intense exercise. So you are absolutely right, sir, that not only the type, but the intensity of exercise also matters.
and in elderly hypertensive who is taking chlorthalidone in a hot summer, do you restrict
Elderly,
in a salt restriction? Do you advise elderly hypertensive in a hot summer, in Lucknow, the hot summer at 44,
yeah,
45 degree? Will you reduce salt or you will say go slow on the salt?
I
Chlorthalidone.
think Dr. Swati brought it out that that should not be taken as an excuse to take extra salt, saying that we have sort of lost salt in our sweat. That's very minimal.
Okay.
So perhaps I think this dietary thing has to be built in us as a habit. If we make too many indiscretions, if we have too many exceptions, then it's going to be difficult to achieve the end result. In fact, I was going to ask Dr. Swati, I mean, everywhere we can say that fine, you do exercise 5 days a week. You sort of do it something like this. So is it also for the dietary intake that you occasional indiscretions matter too much, or they are reasonable? This is a sort of a question which many people ask, that once in a while we are going to a marriage, we are going to a party, we are having a party at our home. So will an occasional indiscretion undo all the benefits that we have been doing?
Swati.
So a very, very valid question, sir, and very interesting also. So there are patients in the OPD who come up with this question. However, the key is how occasional this occasional is. So I always ask how occasional this occasional is. Once a week samosa, can we have, madam? Yes. Once a week jalebi, once a week chips, once a week pakoda. But if that once a week becomes once a week for samosa, jalebi, pakoda, chips, then all 6 days or 7 days are covered. And they say we had only once a week. So that should be allowed. So the challenge here is we have to set the limit. Yes, occasional deviations are allowed, because otherwise the dietary practice or the dietary counseling becomes impractical. If we tell, oh, you can never eat this. No, that is not the case. Moderation is the key, but that occasional has to be actually occasional and not the everyday occasional.
Yeah, I think Nakul has asked a very relevant question, because we always say 5 days a week exercise, because we want the muscle to take rest, see, muscle to regenerate. Suppose we do every week, a full week, the muscle gets, fatigue, and then you have to give 1 or 2 days rest for the muscle to regenerate. That's why we give, not the diet. In fact, when you say 1 day occasionally, they will have occasions for every day, like my wife's birthday, then my wife's wedding day, and my father-in-law's death day. All that, they will take something extra. So we must always be very strict in the diet, and whatever you said is correct, because lifestyle modification. By the way, Nakul, how many of your patients follow your lifestyle modification? Honestly, tell me. You are taking some time.
Sir, first of all, very difficult for me to find out.
Yes.
They always promise something, but when you go deeper into that, you find loopholes. So it's very difficult to see what to believe, what not to believe. But I tell them that you have to show me the result. Show me your weight loss. Show me your better blood pressure with the same medications. Show me your better HbA1c without increasing the medications. So then they become sort of cautious, and many of them will skip their visit because they know they are going to get a hiding. So, but I think it's more should be a result oriented. I tell them to maintain a diary and show me what has been your weight, what has been, because otherwise they will sort of promise everything and do nothing.
Yes.
And
that's
a common malaise, we can say.
In fact, why I asked this question, I am a strong proponent of home blood pressure monitor. I always tell them, take the home blood pressure monitor, do exercise. After some time, you take the blood pressure. Definitely, there'll be some, reduction. And, by doing exercise, by by counter checking with the home BP monitor, the people are convinced that, exercise definitely has a role in reducing the blood pressure, because, that's why home blood pressure monitor we always promote. Nakul, before one thing, alcohol, your views on alcohol and hypertension.
Sir, first of all, I am actually what you call Sufi, a teetotaler. But
Okay.
I mean, again, everything in moderation. I say people say that we are sitting in a company, we need social drinking. Okay. I say make that social with a small letter S, not a big capital letter. Don't have large drinks, don't have too many frequent drinks, don't munch snacks, and make your one drink last for more than an hour or two. And only then you will be sort of not going overboard with that.
Yeah.
So that's again a difficult question, and I'm very sure more than half of the people won't listen to what we are telling them.
Correct.
They will just say nod their head, but then the moment they go out of the clinic, they will be sort of forgetting everything.
Yeah.
One more small question, Dr. Swati.
Yeah.
What about this green tea business? I have been reading about it. I'm not able to balance out the evidence. And what would be your comment, Dr. Muruganathan, on the green tea?
Yeah, Swati, you first tell me, and then I will talk about it.
So green tea, if we say, yes, there are studies which shows that it has little benefit. But for us, we should understand what are the benefits we are trying to achieve. For example, green tea is simply a hot water, warm water. Drinking it makes you actually feel full. But if you compare it, actually drinking a normal glass of warm water also would make you feel full. So,
Okay.
Sorry, sir.
Yeah, go ahead. I'm
Yes.
saying go ahead.
Yeah. So yes, there are studies which show that there is an impact, but there are also studies which show that there's hardly any impact. Depends on the overall diet consumption which a patient or a person is actually doing. Having a heavy meal, or excess of calories and all other sodium, fats, and then having green tea or any other thing is not helpful. Anything in moderation as part of a proper balanced diet is what we recommend.
Yeah. In fact, the international, Nakul, international hypertension guidelines, if you see, they mention one of the diet as a green tea, pomegranate juice, hibiscus tea, etc. And they say they can be taken. International hypertension guidelines 2020 says green tea. Green tea, as for China, people, when you take green tea after food, it helps your digestion. For example, you take some fatty diet or a something, when you take hot, as you said, hot water, green tea, it always helps for digestion. And that's why they say green tea. But what green tea, what we get is not the tea what they refer. So it's always that. Another thing also, coffee. In coffee drinkers, they say if you take 3-4 coffees, it'll be good. But only thing is they should not take milk. They should not take sugar. It's a black coffee. If you take 3-4 times, it's supposed to be good for diabetes and hypertension and obesity. But who takes black coffee more? They don't take. Normally they take coffee with milk and sugar, which is not good. So as Nakul said, anything in moderation is good. Even alcohol, the people who are taking alcohol, they're very good. They bring the internet news saying that 1 ounce of alcohol every day is good. And who takes 1 ounce of alcohol? They always take. They don't have the limits. The peer pressure, they take more beers. So I think I always tell them, as Shakespeare says, alcohol gives the desire and takes away from performance. So they don't take alcohol. I won't say even take 1 ounce. No, then there's no meaning. So and the wives will be unhappy if you say take all. I mean, your husband can take one alcohol. She will not come to you again. So always better avoid. Better tell them don't take alcohol. And these are the small things. I think now it's already 10:30. Now, Nakul, your final comment for all our viewers on overall hypertension management, not only lifestyle modification. You are experienced person with an intensive cardiologist, and your views
Sir,
on
first
overall
of all,
hypertension.
I think we should increase the awareness of hypertension
Okay.
and let the people know that it strikes those where least expected.
Okay.
People often ask us, we are so lean and thin, we don't smoke, we don't have diabetes, we have no family history. Why us that we have had hypertension at young age?
Okay.
And I have to tell them mostly the reason is absolutely unknown. That's why we call it sort of idiopathic.
Yes.
So awareness has to be increased, and it's so easy, as you said, by the blood pressure monitors which are available. People have a little hesitancy about using these blood pressure monitors. They don't really trust them, many of them. But then I tell them, I have made a small chart of telling them how exactly to use, what are the 4 or 5 points they should take precaution when using these monitors so that you get to a near good reading as possible. And the third thing I tell them, that blood pressure is never variable. It's like a flowing water. It cannot remain static. If it remains static, I think you are done. Not only blood pressure, but heart rate. So it has to be variable. It has to change. It depends on your requirement. It depends on the time of the day. It depends on the food, your activity, your thoughts, etc., etc. So once they get to this idea, I think not only the awareness, but a realistic idea about the control is there. Because otherwise people will come with all chits and saying, see, I've had a 5 millimeter rise in evening and 2 millimeter fall in the morning, and what to do. So I have to tell them, just forget about it. Draw big lines that if 50% of reading are above this line, then you come. Otherwise, don't bother too much.
Yeah.
So
that's what nice guideline says. First 1 week only we have to take twice a day. And after that, once in 2 weeks or once in a month, because we start taking every day, you will have no peace of mind, because people sometimes very obsessive. They will call you for everything and anything.
yeah,
that's one good thing. Now, Vidita, are you there? Vidita is from Gangtok.
Yes,
Nakul, you will not be happy to know. Vidita is from Gangtok. There, they take salt in coffee. So Vidita, your experience, Gangtok, please.
Yeah, that is a salt tea. Here, something which is very common is that they take salt tea. And when I had first joined, and when I would tell my patients, don't take added salt, and then suddenly patient would say, Madam, what about tea? I said, no, you can take tea. You are not a diabetic, because I would always think that they're talking of sugar. Then they would say, no, what about the salt tea? So then I realized that here it is salt tea. So basically, when we are giving lifestyle modification, the local dietary customs, the local other religious things also need to be kept in mind. Of course, otherwise, because of the hilly terrain, most of the people are quite physically active. So they do a lot of exercise. daily, means it's a part of their lifestyle. They walk here and there, they keep going from one place to other by foot. So that is there, sir.
Thank you. That's why I asked Rita, strange experience, Nakul. When I first heard in the Gangtok, when I went, they offered me salt tea. That was the first time I knew people take salt in the, tea. Okay, thanks, Birita. Sangram, are you there, Sangram? Sangram is from Gulbarga. He's again professor.
Yes,
Birita
sir,
also is a dean, from the Gangtok. Sangram, yes, please. Sangram, your comment, final comment, any comment you want to make on hypertension, on this dietary modification?
Everything has been discussed, sir. Not much. Only my request is, my comment is to follow lifestyle modification. All the basic requirements to be followed. Measure the salt, dietary exercise, lifestyle modification exercise to be done. That's all. Nothing much.
Yeah, okay. So thank you very much, and thank you, Nakul sir, for joining us. And I'm very happy to interact with you. You are such an experienced cardiologist. And Swati, first time I heard talking, I really thought somebody should know something about salt in and out. So we selected Swati, and I think it's a very good choice. You covered all the points. And only my message to all of you is, lifestyle modification is like a regular life. Whenever you want to go to temple, whenever you want to go to church, whenever you go to mosque, go by walk. Don't use lift, you use staircase. And when you want to go shopping, go by car, walk. And then when you go around in the shopping mall along with your wife, that itself is a good exercise for you. So lifestyle modification is, you have to change the life in such a way that you do. Don't watch television in the more than 2 hours. Don't sit and eat in front of television. All that. And I will say in one sentence, lifestyle modification depends on the lifestyle modification. If the family wife is good, knows about all these things, she will not put salt, she will give more vegetables, more fruits, she will make you walk, and she will give all sorts of advice, and she says stop alcohol, stop smoking. So lifestyle modification also depends on the lifestyle modification. And my dear brothers and sisters, I'm happy you know about lifestyle modification. Please take some time to talk to your patients. We all know what is lifestyle modification. We don't talk to the patient. We let's give the prescription, come next time. So we also should focus on, that's why you should have good counselors and advisors like Swati in the clinic or hospital, who will take exclusive dietary concept and advise them, so that in future this will also help them to control blood pressure. With this, thank you one and all. It's already now 10:40. We'll meet next time. Mega Dubey, please make a note of the 3 winners. We'll
Yes.
send the home BP
Yes, sir,
monitor
I
to them.
noted.
And we'll meet next time. Vidita will be our moderator. I'll be
Yeah.
the speaker on simplified protocols, and Sangram will be the panelist. So Nakul, we will be happy to have you some more time in some of the other webinars. Looking forward to interact with you, Nakul. It was
Absolutely.
good talking to you. It was
So
good
nice
talking
of
to
you, and I must again compliment you for all the effort.
Yes, sir. Yes, sir. Thank you. And I compliment to the South Asia World Lung Foundation, Sanjay, and also Banu, our Resolve to Save Lives person, who are also watching the program. Anupam is a Resolve to Save Lives person. He is from US. He is also watching the program. So I convey my greetings. And again, once again, happy Vinayaka Chaturthi greetings. Enjoy your Vinayaka Chaturthi, but don't eat sweets, don't eat salty diet. Thank you very much. Good night.